sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, M.D.
Good morning, everybody. Good morning, everybody, and welcome to AM Impact on Your Health. AM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AM Impact on Your Health is heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and where we do encourage you to call in to join in today. And believe you me, a different kind of show for me today. Our guest today, well, he is an anesthesiologist turned alternative medicine doctor located now in the South Hills area of Pittsburgh. Been doing this work for a number of years now and has his own radio show. Been doing that for over 12. He is the featured guest tomorrow evening at the Freedom of Choice in Cancer Therapy Group. His name is Dr. Dennis Courtney, and he's going to be our guest today. Allow yourself the opportunity to ask Dr. Courtney whatever you'd like to ask him after we take that first break. But we will be talking about the topic for tomorrow evening at great length today when we have him live on this radio show as we proceed with today. As I said, it's a little skewed, folks, but I think you'll enjoy it. I know I'm looking forward to tomorrow evening's spot up there, and we're going to talk about what is going to be going on, and hopefully you don't want to miss it. I'll probably maybe quelch some of the thirst that's beginning to develop in you all on what tantalizing morsels I'll be serving up there tomorrow night. Now, obviously, in the course of our discussion today about tomorrow evening, if you want to call in to ask a question or make a comment, that number, of course, as always, will be 412-825-6262. That's 412-825-6262. A little different show today. Looking forward to it with you. Now, up and coming, we've got, just talked to the PR group yesterday, a very large group that oftentimes brings guests to me. One coming right here from the Pittsburgh area. I don't have her name yet. She's going to be scheduled for the 23rd. Interestingly enough, she is into the art of yoga. In fact, she uses it in her own particular personal health story where a severe chronic pain situation befell her, and the only thing that ever worked, at least from what I can understand at this point, is that when she got involved with yoga, which she now teaches, and hopefully will teach you about how to use yoga in that regard, maybe many others. She'll be our featured guest next Wednesday on the 23rd. Been talking to Edward Kane, got to have him lined up probably before the end of the month also. And then we'll be turning the page into the month of December as it stacks up right now. David Brownstein will be coming aboard with us on the 2nd of December. I've selected one of his 10 books. He said, just pick one. And so I did. The book is entitled Drugs That Don't Work, Therapies That Do. It should be right up our line here for what we have been doing on our radio show for years. David Brownstein, our guest on December 2nd. Dr. Susan Smith-Jones returns on the 7th. The Pearl Harbor Day reference. I won't get any further into than that. Talking about 10 ways. Now, last month, literally last week, talked about the ways to help prevent any weight gain over the holidays. And then keeping with that theme about the holidays, talking now about, on the 7th at least, 10 ways to avoid, and if you unfortunately have a little too many of those toddies over the holidays, how to make certain that you get rid of that dreadful hangover. That's going to be on the 7th of December. And that's the way the calendar of events shapes up right now. I want to mention MCG testing. Next week now, we take our show on the road. We're going to be out at our Eastern venue, and going to be a continued presence. This isn't a one-time only thing, as you can very well remember. In years gone by, I used to be out in Monroeville office, which was the previous offices of Dr. Oliver Caminos, Mental Health Services. That building now abandoned, meaning he moved. But he literally has moved across the street. He needed to move. He ran out of space. In fact, he had no space for me. And so we had to end our time out there, which I really enjoyed, being able to see you folks who live closer to the Monroeville area and than here. And of course, these are very treacherous miles to cross, because you've got to go through some holes, you've got to cross some rivers, and you've got to contend with rush hour traffic. I certainly understand it, and that's why I enjoy being able to announce that we're coming back to the Monroeville area now that Mental Health Services is located across the street at that first light that you have to go through on Mosside Boulevard as you're coming over the hill. You'll now turn right coming down that hill, and about 20 yards later turn another right, and you're into Mental Health Services. New facility. It is an expansive facility, plenty of room. We're going to be doing MCG testing there as our kickoff return, and that's going to be on the 22nd. That's next Tuesday. We're going to be out there doing MCG testing. If you feel like you'd like to participate in this, you've been holding back because, well, South Hills of Pittsburgh are just too far away, too treacherous to get there. We're now going to be in your own backyard. Hopefully you will avail yourself of the opportunity to get MCG testing done there. We're really proud to be able to bring it to you, this unique test. Of course, a 6-minute test while lying motionless on a bed with a couple of clips around the extremities. Well, one around each ankle, one around each wrist, and then one lead, a sticky lead off the left side of the chest. This device will sweep you and assess 160 different data points, one new test occurring every 82 seconds. That means in the course of the 6 minutes, you're going to be swept 5 different times to assess your parameters, your cardiovascular parameters. I continually say, I don't know how it does it. It just does. From my perspective as a physician, I don't know about the electronic wizardry and circuitry involved, but I do know that whoever they had to prove it to, that this information would be accurate, certainly has felt that that is the case. FDA has approved this. This is insurance covered. This is a way to determine what the status of your coronary arteries are without having the dreaded gold standard, and it is a gold standard, called a cardiac catheterization, ever done. I don't want any one of you to ever require it, because you really can't ask for it. You just don't step up and say, I'll take one of those, because you have to have some serious symptoms in progress in order to qualify for one of those. And one of those usually has the chance of such risk and such consequence that everyone would avoid, understandably, the cardiac catheterization like the plague. But we can find out the status of your coronary artery, some pretty important vasculature in your body without that busted muscle, and that consequence by utilizing this MCG testing. It's called multifunctional cardiogram, and we have the device now. It's in our offices 2 weeks out of the month. We'll be carrying it out there with us, a very compact device out there for the 22nd. If you would like to be seen out there, give us a call here at the office, 412, excuse me. You can do all this right here, 724-942-3002. We'll schedule you here for a time slot out there. If you already be seeing Dr. Caminos anyway on that day, we'll arrange to have you done while you're there. And so you really can't kill 2 birds with 1 stone. Many of you do see Dr. Oliver Caminos from the cardiology viewpoint, his viewpoint. And nice to know now we're going to team up again and be back sort of in the same facility, doing what we did once a long time ago. Not all that long ago, maybe about 4 or 5 years now since we've been back. But nonetheless, it's nice to be able to return. MCG testing returns here. Now we're going to I'll be announcing the date in December for all of you out there who might like to take us up on this invite for our South Hills office. And we'd like to have one day a month set aside for our listeners who listen to me on this radio show, think they might like to avail themselves of that opportunity. I'll be giving you that date. Let's say by Friday. I'll take a look at the calendar and come up with a date in the month of December. Hopefully it'll click for you. I know a lot of activity going on in December, so it may be a good month, it may be a bad. Nonetheless, MCG testing will be available. HCG, a lot of G's here. Human chorionic gonadotropin. Yes, it's the pregnancy hormone. We're not interested in as to whether you're pregnant or not. You may be. But we're interested if minute amounts of human chorionic gonadotropin can be detected, because this is, as it could turn out, to be the earliest possible way to determine whether there's a cancer on board in that individual or not. It's all based on a trophoblastic theory that was developed by Dr. John Beard at the turn of the last century, 1904. But it has been proven out scientifically to be absolutely correct that the origination of all cancers comes from trophoblasts that literally are found in every organ of the body. And trophoblasts manufacture HCG, and it's just now and only now that we have a testing that's so sensitive that it can pick up such minute amounts that it can detect cancers in a cluster as little as 12 cells. Anyway, HCG testing not available. Now available here. We don't do the testing here, but we are the draw station for American Metabolic Laboratories. You've heard, and some of you have met Dr. Emil Shandel here on our radio show. You may have met him up at the Freedom of Choice and Cancer Therapy Group last year. That's when he was in town. And many of you were intrigued with this possibility, and we have followed up and tested many folks here who thought they wanted either to determine whether they had any cancer going on at all, or have had a diagnosis of cancer and want to make certain that that cancer has been eradicated. I find HCG testing could actually fill that bill quite nicely, and to let you know that we do it here. Call in. The way the process would be put in play, you had to call in to come in and pick up the kit, because the cancer profile at least has a urine component as well as a blood component, and the urine component has to be first void of the day, midstream, clean catch, and that has to be done at home. And then once you bring the urine specimen in, we can then do the blood work and have that thing out the same day. We wouldn't want to do this on a Friday at all, because we wouldn't want to lay around over the weekend while it wasn't moving toward its destination. But any day except Friday should work quite nicely. Anyway, give us a call and come on in and pick up those kits. Now, in the news, a lot of things in the news. This one really caught my ire last week because, well, you knew it was going to happen. And sure enough, it's underway. Now, it's just hasn't crystallized yet, but these little feelers that get put out oftentimes foretell what is around the corner. And so, lo and behold, there it was. Panel says, check kids' cholesterol, kitty cholesterol checks in those who are 9 years and above. Now, we can get into a lengthy discussion of the correlation they're trying to make between obesity, dieting, cholesterol levels, and cardiovascular disease, and as to whether or not there's a relationship between elevations in cholesterol in children and how that translates into adult issues. They're very unclear. In fact, the article quite honestly states, what was the quote? They concede that there's little proof that testing now, meaning in these kids, will prevent heart attacks decades later. Yet, I can see the handwriting on the wall, can't you? The pharmaceutical realm is pretty beat up now. Statin drugs, still one of the #1 prescribed drugs out there. And up to now, the kiddies have been left alone. I think you're going to see where the kiddies aren't going to be left alone anymore. I think that these doctors are going to love, and pediatricians in particular, are going to love being involved with what you're going to think is noble work. And what you're going to be seeing next is Kitty Zocor, or Kitty Lipitor. Especially now knowing, as you might not know, that Lipitor patent has run out, and Lipitor will soon be placed on the over-the-counter market. And it's just not good if you're Merck and you own the patent. To find out that the patent is leaving you, how are you going to recoup that revenue? I think I see a solution for Merck on the horizon. Check the kids and put them on the cholesterol statin regimes that you have had on adults for so long. Not a mention in this entire article on doing that. Not a mention about, well, logically, if we're going to check cholesterol, wouldn't it make sense that we then put them on statin drugs if we found their cholesterol levels to be elevated? Not a mention. But this is how it starts. This is how the attack begins. Just get ready for installment number 2. Oh, I'm going to say 3 months from now, to put the feeler out on this one. It gets the water, you get dip the toes in the water, just get used to it. It's a little cold in here. Things are going to be heating up, though, when you start talking about putting kids on statin drugs. Are parents going to put up with that? I don't really know. Well, I know my family. What about yours? What do you think the general public in general is going to say about it? Kitty cholesterol checks around the corner. And around that corner, statin drugs looming. I swear to God, that's where it's going. And it'll be revealed. We'll bring it to your attention as it unfolds. All right, let's do this. Let's take a short break, and then let's get to our guest. You know what I mean here. I've been invited up there to the Freedom of Choice and Cancer Therapy Group. I want to talk about what I'm going to talk about, give you an opportunity to talk about it. Be right back in a moment with the featured guest.
Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, M.D., is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Honey, just got the word. The company's new health plan has a $5,000 deductible. We have to make sure nobody gets sick this year. Remember what those doctor's visits cost for last year's colds and flu? Oh, sorry, I gotta go. Love you.
We can do this. We can cut the fast food lunches. Soda, that's a lot of sugar. We could all take that evening walk. And hey, I heard a program about fruit. Fruit of the spirit. What did they say? 1 ounce, the equivalent of 5 servings of fruit with herbs and minerals. We could add some to our breakfast protein shake. Fruit of the Spirit is unique whole fruit puree. Fruit of the Spirit contains fresh fruits native to the Holy Land and alkalizing minerals from the Dead Sea. With no added sugars, Fruit of the Spirit is a unique product from 5 years of work from science-based nutritional experts. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. Fruit of the Spirit, convenient, affordable, and delicious. That's 1-800-442-3793. Call them now, 1-800-442-3793.
Good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Right here in KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you today on a Wednesday version of the show, and in keeping with a pledge that we've made a long time ago, we've always tried when possible, and it's almost always possible, to take and have an opportunity to bring to you the guest at the Freedom of Choice in Cancer Therapy group presentation that's taken on every month, usually between the months of September and June. They say third Thursday, and they rarely keep to that, by the way. This particular case, the guest this month will be there on the third Thursday of the month. That happens to be tomorrow evening, and as I think I'll let you know on Monday's show, that I will be that guest up at the Freedom of Choice in Cancer Therapy group. I have been there before. It has been quite some time now. I'm going to say, it's been 4 years maybe since I was last there. I've always enjoyed bringing you the guest for that particular month, giving you an opportunity to hear he or she first here, hopefully titillating you enough that you'd want to take a trip up there to Butler. Many of you live north of the city, and that's an easy trip for you. For those of us who live in the south of the city, that's not so easy, but many times the guests themselves actually are that titillating that you take the trip. I'm hoping that you take me up on my offer to come up and listen to my presentation to you tomorrow night, the Freedom of Choice in Cancer Therapy group. Of course, as I said, it is the third Thursday, and everything else matches up too because it is at 7 o'clock. It will be at the Days Inn just south of Butler, there on the right-hand side as you're moving north on Route 8. And as to what the speaker is going to be talking about, I've gone over. I talked to Sylvia last week where this first came up, and I absolutely accepted her invitation to come on up and speak to you all. I had no idea at the moment I was speaking to Sylvia what I'd be talking about, but goodness, there should be quite a bit to talk about. And then it struck me as I was going over so much accumulation of stuff that I have here, I came across it. The moment that I did, I said, oh, this has got to be exactly what to talk about up in Butler. And so I can announce to you now that the topic of tomorrow's evening discussion will be the 7 deadly sins of conventional medicine, 2011. Now, that particular topic has a little ring to it. You should have heard it before because it was quite a long time ago that we had our first presentation. This was first delivered by me. Well, I'll put it to you this way. I've delivered this presentation on 2 occasions. The first occasion, and this does date back to 2007, I gave this presentation, The 7 Deadly Sins of Conventional Medicine, to a group that was participating in a conference held at the Holiday Inn in Braintree. And this was something put together by Faith, Faith Delegowski, and she had quite a nice presentation that day. She had all sorts of vendors and all sorts of speakers that were giving lectures literally around the clock over a 2-day period. I happened to be one of the speakers on the second day, and I had really done quite a bit of preparation in preparing myself to give that presentation of the 7 deadly sins of conventional medicine. I will say you really responded then because that room, and it wasn't necessarily a large room, but it was packed. What we learned at the beginning of this is that you got to check out your audio-visual aids first, folks, before you announce that you're going to give a presentation, because what we learned was, although I had all the slides made, and they're in my computer, the device that is able to take the computer image and shine it on the screen, well, that device, and I can't remember exactly what, but it just didn't work. And so after mussing and fussing for about 20 or 30 minutes, I said, the heck with it. If you don't mind, I said to the audience, I won't mind. I'm going to give this thing a cappella without any slides at all. I hope that it works. I really didn't know if it would. So I hope that it works. But here goes. And so there I did. I went off, took it off to the races, And for quite a lengthy amount of time, over an hour and a half, I'm sure, I did my best rendition from memory of that particular information I had gathered. It was so fresh in my mind, having had gathered it to prepare for this, that it wasn't all that difficult to do. But it was startling to me to learn that I had to give that a cappella with no AVA, just take it from there. Talk about being able to, switch gears, as we often say in this show. Yeah, I had to switch gears, and I really enjoyed giving that presentation on that day. I thank the people who were nice enough to come out that day for bearing up under what were inclement conditions with respect to not being ideal, but there we did. We finished it, and I was very happy to have been able to bring that information to you. It, however, wasn't complete without giving it in full Technicolor 3D with surround sound, if you know what I mean. Giving it a cappella was fun. I was challenged, and I did respond, but it was a yearning in me to give that thing again. And that opportunity came by me on, it was August the 5th. I'm looking at it now. August the 5th, 2007, when there was another conference being held in town. This one was out at the Radisson Hotel in Monroeville, and I gave it again. On that particular occasion, knowing how I flubbed up with the audio-visual stuff when I was in Green Tree, I actually went ahead and procured a videographer. I said, I'm doing this one more time, and I need everything to be right, because I'm not doing it again. And we went ahead and we gave it to, I'll have to say, a much smaller audience than what was at the Green Tree Group, but it was recorded for posterity, and I've kept those discs now for many, many years. I've sort of pushed them aside. I haven't really taken a look at them, but when I mentioned to, when I actually accepted the invitation to address you all once again up at the Freedom of Choice and Cancer Therapy group, and I saw that disc sitting there, I went, this has got to be it. Time has passed. These 7 deadly sins of conventional medicine are as deadly now as they ever were. I will say that there should be some redundancy. Obviously, if I felt them worthy enough to make the list of the 7 deadly sins of conventional medicine back in 2007, you would have to have heard over these many years since, oftentimes, these themes running into and around the themes that come up here continually on the radio show. And that for sure is true. But as I took the time yesterday to go over and listen to the entire presentation as was delivered on the 5th of August in 2007, I could see that not much changed. Some additions. Nothing to change, really. Everything that was contained in that original presentation, I say the original one of August 5th, the one that was done to a lesser number of audience but was recorded for posterity, I think I should not change a thing about that presentation. I only need to do what I'll do for tomorrow night, and that is I'll bring the update to 2011, because the sins have had some changes within the sin itself, some other enlightenments, some other ways to do assessments, but these 7 deadly sins are still out there, and they need to be updated and upgraded for a 2011 audience. And so, as my second promise to you, I will do just that. I'm going to deliver this thing in a similar fashion, the way it was done back in 2007, but I will add in all of the pertinent information that has been accumulated on each and every one of those sins between 2007 and literally we're now ready to jump into 2012. So this is all inclusive for 2011, and so much has happened and so many additions can be made that it should make the additional presentation, this third presentation, at least up to speed with respect to the times that we're in. Now, I'll make another promise that tomorrow evening, when I'm up with the Freedom of Choice and Cancer Therapy group, I'm going, because I've never spoken about any of these here on the radio show, which seems a little odd because I tend to really bring to you everything that I'm thinking about every single day I do the show. But there have been two new programs really to the point of being launched now that I will reveal tomorrow evening to you. A small group. Well, it gets pretty big up there, actually. But the group up at the Freedom of Choice and Cancer Therapy group, I will leave you with the launching of two absolutely brand spanking new protocols and programs that I think I needed to bring into my office, and I'll be bringing to this radio show many, many times in the future, but haven't spoken on either one of these at all. Not even a word up to now. So they are brand spanking new, and that'll be my third objective tomorrow evening to describe and launch those two programs for those who are nice enough to attend. And that should pretty much round out the evening for us up there, obviously allowing for any questions you may have before the evening is over. Now, what I want to do is take a short break. When I come back, I'm going to touch upon some of the salient points of those sins and talk about some of those sins and so forth, just in a titillating way. I'll take phone calls if you have any questions for me. Want to make it, by the way, was anybody listening to me now at either of those other two presentations? I mean, were you at Green Tree or were you at the Radisson? And if you were, do you remember that? And what do you remember? And let me know. Sort of trying to relive old times, and you might be able to help me relive. I'll be back in a moment with more on the featured guest at the Freedom of Choice and Cancer Therapy group when we return.
Want to help your family eat healthier? Instead of learning to disguise tofu in wondrous ways, how about some real nutritional power? If your family has the typical American palate for fries, pizza, and burgers, giving your family the blessing of good nutrition is a struggle. Fruit of the Spirit is the answer for your family's nutritional needs. Fruit of the Spirit is an all-natural, whole fruit puree made from fresh fruits native to the Holy Land with alkalizing minerals. Fruit of the Spirit was 5 years in the formulation, the work of a team of top nutritional experts with independent science to confirm its antioxidant power. 1 ounce a day provides the equivalent of 5 servings of fruits and minerals. Fruit of the Spirit is convenient, affordable, and delicious. Even your picky family will sing the praises of Fruit of the Spirit. Give your loved ones the blessing of good nutrition. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. That's 1-800-442-3793. Call them now, 1-800-442-3793.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Hey, good morning, ladies and gentlemen. Welcome back once again to AIM Impact on Your Health. Right here on Gauge B620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you today on a Wednesday Virgin Show Freedom of Choice and Cancer Therapy Group Show. I'm going to be the guest out there tomorrow evening up in Butler, 7 o'clock, Days Inn, just south of Butler there, about a mile, where we're going to have at it once again with what I brought to you initially a number of years ago, but updated for our times because so much has happened. I referred to the lecture then, I continually refer to it now as called The 7 Deadly Sins of Conventional Medicine. It was fun. It was a play on words at the time. Now, I'll re-explain how that original title came out, but I should mention, because as I listened to this disc yesterday, and it's been, I don't think I remember ever listening to this disc ever since I put those discs away back in 2007, but nonetheless, having had a chance to listen to it again, it sounded, pretty bad. I was taking on my profession in a way that is a bit unfair. I thought, my goodness, I should at least say, well, what I'm about to say, which is, there are many, many virtues to the conventional medical model. Absolutely many virtues. I feel quite honored to be a member of that group, especially when we're talking about acute problems. There's none better in the world in terms of our hospitals and our medical expertise when it comes to any acute situation that you may be undergoing. You cannot be moving to taking an herb, sucking on a root, doing all these nice alternative therapies if you have an acute medical problem. And so the virtues are so numerous when it comes to the conventional medical community, and I think you would agree that you want to be taken to the most sophisticated medical facility that you are aware of, and that it is possible for you to receive if ever you have an acute event befall you. Heart attacks, strokes, get hit by a car, fall off a platform. These acute events are dealt with by us better than any other single medical model in the entire world, and you should be doggone proud that they're available to you. The line of demarcation, however, occurs whenever you start parsing up what's acute and what's chronic. Because I'm afraid that when we move into the chronic area, that's where the criticism, that's when the potential for developing peccadillos and sins actually do emerge, and then they emerge at a rate that it just becomes almost embarrassing to even calculate. And so coming up with 7 sins, in a way wasn't hard, because there's so many sins out there. I had to pick what I felt to be the 7 most egregious, most obviously all-pervasive sins that were being perpetrated and continually are perpetrated on the American population by virtue of having doctors with such good intentions end up going awry because of the tools that they have, these drugs, which end up causing so many more problems than they actually went out to correct. So there are many virtues of the profession, but when it comes to the 7 sins, they're not just 7. There are, well, who wants to put a number on it? There are many, many more than the 7, but we picked up 7. There was a biblical reference there, and I pick up on that, and I'll be explaining that tomorrow night. But coming up with these 7 was fun back then, and it'll be fun tomorrow evening as we plow through them again. I will say that there is a disproportionate distribution of emphasis spent on the 7 sins. I didn't really realize it until I viewed the discs once again, but for the first 2 sins alone, I was looking at the time mounting up, and these first 2 sins, these really important sins, and they didn't really require that a lot of attention be paid to them, are the 2 most prominent and prevalent life enders out there. You hear me talk about this a lot, and it probably emerged as a part of my office lexicon at that time, which was to talk about sins of the heart, which is the first sin, and the second sin, the sins of the zodiac, I called it, which had to do with cancer. These 2 disorders, because they really occupy 90% plus of all the deaths each and every year coming from just these two disorders alone required a lot of time, because there's a lot of sinning going on out there in the conventional medical community when it comes to the treatment protocols utilized in both. And so I'll be spending the same disproportionate amount of time tomorrow evening as we begin to take a look once again at these 7 deadly sins, and taking an inordinate and an exhausting amount of time in those first 2 sins, because the kind of disease processes out there are so enormous in terms of their frequency and their profundity, and the fact that they are life enders, that getting you up to speed on them was a primary objective back then, and it still should be the primary objective for today and well into the future. So talking about cardiovascular issues, my goodness gracious, can't you tell with all the emphasis that we place on them here during the show that they had the same emphasis back when we first developed the original presentation, and they will continue to do so tomorrow evening. Cancer, which the second sin that we're going to be talking about is probably, if you had to pick the worst example or the most illustrative example of how the conventional medical community is involved in a pretty undefensible formatting of treatment, it's got to be the issue of cancer. There's so many sins that surround the treatment model of cancer, how it's presented to you, and the things that get unsaid, which I think every time I spend time here talking to cancer patients and their family, we have to take the time to talk about these real large blemishes, if you will, these sins, because I see the same sinning being repeated with each and every case of cancer that ends up being diagnosed and then falls under the scrutiny of the conventional medical community. The sinning is going on each and every day, and if there's one real blight, as I mentioned during the lecture I was listening to yesterday, going over the disc, and we'll come out again tomorrow evening, if there has to be, you have to pick one of the most indefensible forms of treatment that we have out there. It has to be this issue of cancer. I mean, it is absolutely the most egregious set of sins, accumulation of sins, and it gets repeated each and every day. How appropriate that we'll be talking about this with the very group who a number of years ago decided that that kind of sinning was something they really didn't want a part of. Many of them had, as I've talked to you as I've come up over the years, you have your own cancer stories, and many of your cancer stories originated right there in the conventional medical model that at one point or another you decided, not me. I'm not doing this thing anymore. And then you broke away and you moved into some non-conventional treatment that allows you to become a guest even today, many years later and after the fact. You need to be a member, allow you to be a member of an audience such as tomorrow evening. I always enjoy meeting you. I always enjoy listening to your stories, but you're the folks who really champion and are the trailblazers when it comes to identifying the sins as they were, even way back when. By the way, the same sins of 15 and 20 years ago are being committed today without any change in the area of cancer, and it has to be brought to the forefront once again. I hope to be able to cast a pretty bright light on the cancer issue tomorrow evening because it is such an important and egregious part of the conventional medical model. Let's do this. Take another short break. We're going to come into the gun lap. Anybody out there, by the way, who were at those? Was there nobody there? Anybody out there who can remember the 7 Deadly Sins presentation of 2007, either at the first venue or the second one? Love to hear from you. 412-825-6262. Be back in a moment.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dentist J. Courtney, M.D. is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Honey, just got the word. The company's new health plan has a $5,000 deductible. We have to make sure nobody gets sick this year. Remember what those doctor's visits cost for last year's colds and flu? Oh, sorry, I gotta go. Love you.
We can do this. We can cut the fast food lunches. Soda, that's a lot of sugar. We could all take that evening walk. And hey, I heard a program about fruit. Fruit of the spirit. What did they say? 1 ounce, the equivalent of 5 servings of fruits with herbs and minerals. We could add some to our breakfast protein shake.
Fruit of the Spirit is a unique whole fruit puree. Fruit of the Spirit contains fresh fruits native to the Holy Land and alkalizing minerals from the Dead Sea. With no added sugars, Fruit of the Spirit is a unique product from 5 years of work from science-based nutritional experts. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. Fruit of the Spirit, convenient, affordable, and delicious. That's 1-800-442-3793. Call them now, 1-800-442-3793.
Good morning, ladies and gentlemen. Welcome back once again to AIM Impact on Your Health. Heard here in KHB 620 each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney with you today, and in anticipation of a guest stint that I'm going to do tomorrow night, talking today about, what we're going to be discussing tomorrow night, the Freedom of Choice in Cancer Therapy Group, which is holding, as they usually do, third Thursday of the month, or at least they try, and they've accomplished the goal this month. Yes, it will be the third Thursday. It will be at the Days Inn, just south of Butler. It'll be at 7 o'clock, and the speaker will be me. And I'm revealing today what the topic is going to be. It's going to be a reformulation of a lecture and presentation given by me a couple of years ago, a number of years ago, as a matter of fact, back in 2007, entitled The 7 Deadly Sins of Conventional Medicine. Talking about sharing with you some of the thoughts that went into the original construction of that presentation. I had mentioned what the first 2 sins are. There's no problem with going down to this list of 7 to get you ready for tomorrow evening, because with each one of these sins, we have to take off and discuss that sin at great length. So here they come. Sin number 1, of course, sins of the heart. We're going to spend a lot of time talking about those sins and how to cure the ill that comes from those sins. Number 2, the sins of the zodiac, which have to do with cancer issues. Remember, this Freedom of Choice in Cancer Therapy Group is unique in its formation, and certainly under that rubric, many guests that come there come with cancer issues on the mind. Has not been a deal breaker if you have another message. They've always received you well up at the Freedom of Choice in Cancer Therapy Group. When the issue turns to cancer, this group is very charged and very interested. We're going to be talking about, by the way, in some of the updating here, brand new spanking approaches to the treatment of cancer that really have never been revealed before. So I hope to be able to bring that to your attention. Now, the third sin are going to be sins of the breast. My goodness gracious, we just got through another October, and so many sins committed in this area. You can imagine where we're going to go with that particular discussion. Now, it's been a while. Sin number 4, I entitled Sins Against the Family, and in particular, when the family is involved because of the age of the afflicted, in this case, we got to talk about the vaccines. It's probably been an ignored discussion for quite a while. It appears that this is pretty well kicked around by all the talk show hosts here on the Think KHB family. But I had some pretty salient points to bring to you back then. I always, when it comes to the issue of vaccines, tip my hat to my great mentor in this area. Her name is Dr. Sherry Timpenny, located right over here in Ohio. And anyway, she's known internationally on the ills of vaccines. And as it turns out, what a mentor she has been, I'll share with you. Quite a few sins when it comes to the vaccine story. We'll be talking about that tomorrow night. The fifth sin. Sins of the sea of chemicals in the body, and in particular, the hormones. The number one has got to be, and we've talked about it so often here, thyroid. So many other endocrine glands, but the thyroid in particular, however, though, the estrogen-progesterone issue has its own set of ills. We'll mention them tomorrow night, talking about the sea of chemicals. The sixth sin, I had to say, as I can remember now presenting this 4 years ago, that this sixth sin had to do with my own personal bias. You might not have included it in your sins, but from my vantage point as an anesthesiologist and chronic pain doctor, and seeing how it is that my own profession deals with this area, I've always felt this one of the major sins, and these are the sins of agony. How it is that chronic pain gets treated. I think better said, how it is that chronic pain problems get undiagnosed, misdiagnosed, and then consequently, absent the correct diagnosis, how do you ever expect to be able to correct the problem? This particular sin has bugged me for a long time, and that bias will come out tomorrow evening as I discuss what I find to be the big hole, the big thing gone awry. What is it? How did they miss this? Well, I think I know what they missed. In fact, I'm doggone sure of it, and I'll bring that issue up to your purview and review tomorrow. The last set of sins, I had to include these because it turns out that the sins in the name of good dental health, when you think about it, our dentists out there, I think they do, what don't they do? 4 things. They clean teeth, and by the way, many of them don't do that anymore. They have hygienists that do it. They fill teeth, and as to whether or not they use amalgams to do that filling is still up for grabs. Of course, the dental profession has never owned up to the fact that this is such a lethal substance that to them it's still perfectly healthy to use it. They've never, how can you do that? They've never gone back on that. They've continued to put out and spew out this minutia that somehow mercury in your mouth is safe. But however, if you drop it on the floor, you require an EPA hazmat team to come in and clean up what's called a mercury spill. And I mean that for a fact. So this disconnect between how governmental agencies view you dropping, the dentist dropping some mercury amalgam on the floor, and you getting that mercury amalgam in your mouth, obviously, as one of the things the dentist does, it's got to be called an scrutiny. So the 4 things, they clean teeth, they fill teeth, they do root canals, and my goodness gracious, how often we talked about this, and then finally, they actually extract teeth, and there's another problem with that too. So the well-intended, wonderful people that they are end up being at the front end of a whole host of medical issues by virtue of what they do. Except for that cleaning thing, which I don't think can go awry. I think that's good. That there's really no harm to come to you, as I can see it, from the cleaning part. But once that cleaning is over, we got a problem. And every single one of the other things that the dentist does need to be scrutinized by you as the patient, or by you as the parent in managing your children's dental health and how it is that you're going to allow that to proceed, because that's where the insult all begins, and certainly you as a parent are going to want to make certain that your children be treated in specific ways to avoid the harm that comes from it. So, there you have it, folks. Those are the 7 deadly sins. Now, we'll need to go over each one of these and reveal the sin for what it really is. And, of course, that's going to take place tomorrow night. Hope to see you there at the Freedom of Choice in Cancer Therapy group. We're going to update this 2007 stuff, which is just as applicable. Everything that was valid in 2007 is valid now. I haven't found one thing that changed that would make me pull something out of that presentation. What's happened, however, there's a bunch more to be able to put in them, and that's why we're going to update this and call it the 7 deadly sins of conventional medicine 2011. And then finally, too, I want to be able to launch the new programs, the ones that had never been mentioned before on air, and make you a part of history, I think, when I reveal what we'll be bringing to you in the very near future. Bongo in the background, signal my time out of here today. Hope to see you up there tomorrow evening, folks, for those 7 deadly sins. In the meantime, this is Dr. Dennis Courtney, the guest at the Freedom of Choice in Cancer Therapy group, saying so long for AM Impact on Your Health.
Impact on Your Health is sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania.